Have you ever had a cough that made you wonder what exactly was going on inside your body? That persistent tickle or deep rumble can be confusing, especially when you are trying to figure out if it is just a common cold or something more serious like the flu. Yes, a flu cough generally feels quite different from a cold cough. The distinction often lies in its intensity, sound, and the accompanying symptoms, providing an important clue about your illness. The core reason for this difference comes down to how the influenza virus, which causes the flu, and the various viruses responsible for the common cold, affect your respiratory system. Cold viruses typically cause milder, upper respiratory symptoms like a runny nose, sneezing, and a cough that can be either wet or dry. This cough usually develops gradually and is often less severe. In contrast, the influenza virus tends to be more aggressive, leading to a sudden onset of symptoms including a dry, hacking, and persistent cough. This flu cough often feels much deeper, originating in the chest, and can even be painful due to the inflammation it causes in the airways, a condition sometimes referred to as tracheitis or bronchial irritation. To tell them apart, you can pay close attention to the quality of the cough and the speed of its onset. If your cough is one of many symptoms that came on slowly and is accompanied by a runny nose, sneezing, and a sore throat, it is likely a cold. However, if your cough appears suddenly, is severe and dry, feels like it is deep in your chest, and comes with a high fever, extreme body aches, and fatigue, then it is more indicative of the flu. An interesting detail is how a flu cough often feels like a constant urge to clear your throat, even if there is no mucus to expel, because the irritation is so profound. This sensation can significantly impact sleep and daily activities, which is less common with a typical cold cough. Recognizing this deep, dry, and persistent nature can be a critical piece of the puzzle in identifying influenza early. Understanding these nuances between a cold cough and a flu cough empowers you to better assess your symptoms, helping you decide whether to simply rest at home or to consider seeking medical advice, especially if your cough is severe or accompanied by other serious flu indicators.